Greetings, Health Scholars, and welcome back to the For Health Scholars podcast. If this is your first time tuning in, welcome, welcome, welcome. My name is Dr. Orobosa, and I am the founder and host here at the For Health Scholars podcast. Now, today I am very much live, and so if this is your first time tuning in, we have our monthly live chat sessions. You can go ahead and just drop your questions, whether you're looking in from LinkedIn or watching from YouTube. If you just drop your questions in the chat box, I'll be more than happy to pull it up. Let me know where you're tuning in from. It's always great to see who is in the live. So let me go there and give people a little opportunity to join as well. So let me see from the comments. All right. And so today's live chat session, I see a few of you are coming in. So while I'll give people a chance to join the live tonight, today we are going to talk about pivoting from a clinical to a non-clinical career. What are the differences between a professional doctorate in public health versus a professional doctorate in healthcare administration, as well as I got some questions on health informatics and more. And so once again, if this is your first time tuning in, welcome. You can drop your questions in the chat box. Now I see a few people are tuning in. So we have Manny. Let me pull it up here. Hi, Manny. Welcome to the live chat. Also, we have Mopolia or Loretta. I hope I pronounced that correctly, but thank you for joining in all the way from Scotland. It is a pleasure to have you here. And so if you are wherever you're logging in from, just let me know, say hi, ask your questions. And so without further ado, I am going to go ahead and get started. All right. Okay, wait. Some more people are coming in. All right. So let me do some shout outs. Okay. They're coming in at a bulk time. All right. So we have Michelle joining from Maryland. Hi, Michelle. Welcome from Maryland. It is a pleasure meeting you. We also have Kamini tuning in for Cameroon. All right. Well, thank you. I'm not sure what the time difference is in Cameroon, but thank you for being up with me in tonight's live chat session. And so I am very much live. If you have questions, please feel free to drop them in the chat box. Now, I did kind of collected all of the questions that I have received over the last couple of weeks from our community members. So I'm going to talk about that tonight. So there are still some more people coming in. So let's see. La Brea tuning in from Atlanta. Hi, La Brea. Welcome. Chidima is from Nigeria. I hope I said that correctly, but welcome, Chidima. And Kamini says we're 6 hours, which is 10 p.m. your time. Okay. Well, thank you for staying up and joining me tonight. All right. So let's get to the questions that I have. So let me pull those up. Okay. And so actually, before questions, I do want to do some community member shout outs. So we have a few people who are in our community and doing amazing things. And so I want to shout out Aaliyah, Antoinette, and Chelsea. They actually acquired jobs in the healthcare administration management spaces. So kudos to you. And then we have LaShanta. She is a doctoral student in healthcare administration. She just got a full funding for her program. So that is exciting. It is a pleasure to be meeting them, working with them, either one-on-one or the messages that I received, that the content that I have been sharing has been extremely helpful. So shout outs to them. And please send in your praise reports. If you have been watching the videos or working with me one-on-one and you've had great success, then let me know. I will always shout you out. I appreciate it. And it just lets me know that what I'm doing, it is definitely needed and worth it. Okay, so we have a few people coming in. So Felicia, hello. I love this class. Okay, Felicia, welcome. Thank you for joining in. Felicia, you have some questions. So I'm going to go through the questions in just a bit. I do have an announcement. So I am hosting another masterclass next week, Saturday. So that will be August 19th. And many people have asked me, I did a poll here at the For Health Scholars YouTube channel, just asking, what type of topics you would like me to talk about in the master classes, and this one got the highest vote. And so we're going to talk about how to create a LinkedIn profile that attracts recruiters and headhunters alike. And so sometimes we don't always have to chase the opportunities can come to us. And so mark your calendar. And once again, I'm going to go live on the channel, which is Saturday, August 19th from 1 p.m. to 2 p.m. Eastern Standard Time. If you're on the For Health Scholars emailing list, I will definitely send out another announcement. You got one this week, just letting you know that this event is coming up. But I'm so excited to just do another masterclass, which will be held right here on our YouTube channel. All right, so let's get into some of the questions that I have here. And so the first question that I received from a community member is that they love the content that I have been sharing, and they would like me to explain the differences between the DrPH, which is the professional doctorate in public health, versus the professional doctorate in healthcare administration. And the difference really is just the subject matter. And so from the public health side, your work, your dissertation, your capstone and courses are all surrounded around public health courses and the public health curriculum. So keep that in mind. Whereas healthcare administration, that is more of a business related degree. And so your coursework in the doctoral program will amplify your insights on the operational side of the healthcare industry. How do we run healthcare systems? Your dissertation will also fall in alignment with that. So those are just the main differences between the DrPH versus the DHA. Is just the subject matter. One is public health, one is healthcare administration. As far as it relates to your dissertation, which most professional doctorate programs, you have to do a capstone, and the capstones is usually two parts. So the first part is, of course, writing your manuscript, and then the second part is potentially hosting a practicum. And so the practicum is your location in which you're going to collect your data to write in your manuscript. So those are some of the differences that I know off of the top of my head, but I hope that is helpful. I see some more people are coming in to the live chat session. So welcome. I'm very much live. If this is your first time meeting me, hi, my name is Dr. Orobosa, and on this channel, I show current and aspiring healthcare professionals how to, one, quickly and successfully earn their academic degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. So I hope you feel comfortable to stay a while. Make sure to subscribe to the channel, turn on your post notifications, like, share. It is all instrumental and help other people get this information that I do share on the channel. All right, so I'm going to go to the comments because I see a lot of questions coming in. So I want to make sure that I get those as well. So Felicia says, what is worth it, a DHA or a DBA? Okay, so the DBA is the Doctor of Business Administration, and the DHA, once again, is the Doctor of Healthcare Administration. It really depends on your interest and what you foresee using the degree for once you get it. So if you are an individual who you don't only want to be kind of isolated to healthcare, then the DBA may be better, because with the Doctor of Business Administration, it's going to allow you to learn about business in general. Your dissertation and maybe some of your courses will specialize in the healthcare aspect of it, but you're going to learn more about entrepreneurship, marketing, what else comes with the business administration. Whatever is in the business administration curriculum is really for business, any type of business. Let me put it that way. Whereas the DHA is specifically on the business of healthcare. So it looks at healthcare systems, it looks at healthcare operations, it looks at healthcare management, leadership, look at policy, specifically in the healthcare industry. So if you are like, yes, I want to be in the healthcare field, then a DHA may be more of the degree choice. If you're like, you know what, I'm interested in healthcare, but I don't want to be isolated to only the healthcare industry, then a DBA may be more beneficial to you. So those are kind of the distinct differences. I can't tell you which one is better or not. It's really based on your preferences and what you intend to do with the degree once you receive it. All right. So let me go back to the comments. All right. It says stumbled on your page yesterday on YouTube while researching tips on interview for a public health post. Oh, that's awesome, Kamini. I hope that I shared some really good information to help you get started in mastering that interview so you can get hired. But thank you for finding the page and being here tonight. All right. So Felicia says, can you also explain the difference between an MHA and an MBA? So same thing. It's just that at the master's level is a little different than the doctoral level. With the master's level, you're still learning about the business of healthcare. If you do an MHA, which is the MBA, you're learning about just business in general. If you don't want to be in healthcare only, then an MBA may be more beneficial to you. If you just want to be in healthcare, then an MHA is more of the preferred degree choice, but it's just the master's degree side. So instead of doing a dissertation, you'll be writing a thesis or a thesis project. Alicia says, thank you so much. You're welcome. Please continue to do this. Your story is amazing and so inspirational. Thank you, Felicia. Thank you for joining in. All right. So those are the questions that I see in the queue. So I'm going to go back to the questions that I previously received. All right. So the next question I got was, all right, Dr. Owie, thanks for the clarification on the differences. I had a quick question. I have been an LPN for 9 years and a CPHT, but I'm wanting to step away from the bedside full time, get into management, but need to further my education online. I'm trying to find the best affordable college for a bachelor's degree. So I'm not sure where you reside, the person who asked this question, but I will tell you, you can do a great Google search and just look at the top schools in your area that focuses in either healthcare administration or healthcare management. Now, if you watch my video on what are the differences between the two, there are slight differences, but nothing distinct overall. I would say healthcare management is a specialty under health administration. So health administration looks at all systems in the healthcare system, where management focuses on human capital and leading healthcare organizations forward, leading people forward, leading a program forward. And so if you're interested into that type of leadership, then you may find every now and then a healthcare management program. It's really dependent on the universities, how they title these programs. Sometimes the program can be titled as health economics and policy. It's still related to healthcare administration and management. They just worded it a little different. So keep that in mind. I don't know where you reside, and so I'm not sure which colleges that you are in your area, but I do have a few videos on the channel where I review universities. So I would tell you to start there. All right. So I'm going to go back to the comments. I see some questions here. And so Manny says, is there a pay gap between MBA and healthcare management or an MHA graduate? I won't say there's pay gaps because of your degree. A master's degree is a master's degree. And so I don't think they would, from my understanding, they would be paying you different because you have an MBA versus an MHA. I think there's other things that go into deriving your salary. And so if you're a person at a space, Manny particularly, where you're trying to kind of see ideally what is the ideal pay for a role that you may be applying to, you can look at websites like payscale.com and just kind of put in the job position and looking at that job position title and see how people are getting paid. Some organizations do publish their salaries in their public reports or annual reports, so that can be helpful for you. But I don't think that one degree will get you paid higher than the other. A master's is a master's degree, just they have different type of specializations or focus areas. Okay. So Michelle says, what are some careers one can pursue with a DHA or a DrPH? Thank you. So you can either go into academia or you can go into the field. Usually you're going to probably pursue more of the executive leadership positions. So being a CEO, COO. So COO is the Chief Operations Officer, Chief Executive Officer, CFO. If you have a background and a passion for finance, you may go into that. CIO, but it's really the C-suite positions. With the professional doctorate, you can go into consultancy. And so I do that from time to time. If there's an available consultancy consultancy project and it's something that I am interested in, I will go and do a consultancy project for a couple of months. And that is helpful too, because they're leaning on you to solve problems or to fix a problem in their given organization. So that can be helpful to you. And you can use your DHA to do that. Academia is another place. I do work as a professor as well. And as a professor, you get a chance to, share your knowledge in the classroom. So I have taught now safely all degree levels. So I've taught undergraduate, graduate, from the master's level and doctorate, have been a doctoral advisor to students for a university that I work at. And I will tell you, your DHA degree can really help you with that. Okay, Manny says, thank you. And okay, I'm going to go to some of the questions that I have now, and then I'll come back to the comments. If this is your first time tuning in or you're just joining us, I am very much live. Welcome to tonight's live chat session. I'm so excited to connect again. I know we didn't have a session last month. Life was lifing, but I'm back now. So drop your questions in the chat box. And so I'm going over some of the questions that I previously received. So the next one, okay, this is a two-part one. So it says, my question is, I've been a pharmacy technician for nearly 10 years and ideally would love to do something that involves a similar field. As I already know it, are there any pharmaceutical administration jobs that you know that could help me utilize my background? I know I could get on with health insurance companies, and that was the route I was originally going to take. But if possible, I'd love some pharmacy related ideas if you have any. So I did a video with CVS Health, and from my understanding, they do have a few positions where you can do pharmacy administration. Pharmaceutical companies may be another route for you if you don't want to go the insurance route. Administration is just the management of people, of programs. And so depends on a pharmaceutical company like Merck and Pfizer. They may utilize your expertise as a pharmacist who has insight on operations. And so look at pharmaceutical companies, look at the insurance companies. I do know insurance companies will use you also for your expertise in pharmacy, but now kind of helping them move forward, and maybe drug production, drug creation, clinical research may be another background for you as well, because you are aware of how medications are made, how it impacts the human body. So clinical research may be actually a really great area for you to explore. All right, the next question I have, how do I get a health informatics job with having a nursing degree? I have a master's in it. So you look at roles that are available, and most of the time, you as a nursing professional, you're more suited for the clinical informatics roles. And so many organizations will have their traditional postings. Also, you can go and look at the professional associations of the health informatics industry and see what opportunities are there. Networking with people. I'm an advocate for those of you who've been following for a while for networking. So having conversations with people and just seeing what is available in this space can help you as well. Look in the health IT space, because health informatics falls under health IT and they work collaboratively together. Although there are some distinct differences between health IT and health informatics, but they do kind of go hand in hand, as in information technology, because informatics, it looks at the design of EHR systems for the most part, how we can improve user flow and gathering and capturing data when we are running health systems. So explore those backgrounds. If you have a nursing degree, maybe clinical informatics will be the place to start. Okay, so this was a comment. So great and sincere advice. Keep up the good work. Thank you, Angela. So Angela, she's a really, really good champion for the FHS, and she lives in Trinidad and Tobago. So shout out to you, Angela, for your kind words. I appreciate it. Okay, the next question I have, I'm trying so hard to get in this field, but New York is hard. Please, can you tell me what online school is 100% good for getting a CE HRS? So I think this is a certified electronic records specialist certification. Yes, that's what that acronym stands for. New York doesn't take the NHA certification, so I'm bummed. What should I apply to first? So this is a quite loaded question, and I know that you're probably maybe frustrated, the person who asked this question, but Googling, I will do a video in the upcoming weeks about online universities. I do have my own thoughts about online universities. They do have their pros, and like anything else, they have their cons, but I don't distinctly know any university at the moment that offers a online electronic health records program. But you can Google, you can ask around, you can explore, and I'm definitely sure that they can help you with that. Keep encouraged. I know New York may seem hard, but once again, talking to the right type of people, networking can help you, working with recruiters can help you, and putting yourself out there and use a place like LinkedIn can help you. What else can I think of? Outside of just applying online, go to conferences. This is another aspect to explore because a lot of the decision makers, they're at conferences presenting and speaking. So healthcare is very much a human to human industry, and it really depends on you having conversations with people all day. Because think about it, once you get hired for these positions, 9 out of 10 times you're going to have to work in some type of team, even if you don't do it all the time. You're going to have to speak to people. So these are the things to keep in mind. And you go to where the people are who can help you get your foot in the door. And so that's the thing, getting your foot in the door. And I know it's really hard. I'm not underestimating or downplaying how hard it is. And that's just really because of the times that we're in. I have seen positions that once before they were requiring you to have a master's degree, and now they're asking you for a bachelor's degree, or positions that requires you to have a doctoral degree, and now they're asking for a master's degree. And my kind of core understanding of that is that pay. They don't want to pay people top tier. And so you have to just continue to keep trying until you hit that sweet spot. I do believe in the fact that if it's meant for you, it will be for you. I believe in God, and I don't underestimate his abilities to get me to where I need to be. So just tap into your faith and be persistent and stay encouraged. All right, I'm gonna go to the comments because I see a couple of more questions coming into the queue. All right, so Labrea says, do you have any tips for someone with a bachelor's in health administration and a master's in health management, but still struggling to get entry level jobs in the field? So I will honestly tell you, look at the strategy that you have been using. Have you only, Labrea, been applying online? If you've only been applying to jobs online, like just going to a job board and submitting an application, that is not working at this time. I'm gonna just be honest. That is not working at this time. You may have to use a headhunter or a recruitment agency and really put yourself out there. In your case, Labrea, you have a bachelor's and a master's. Go to conferences. Try to present at conferences. I will tell you, in the last 7 days, I've gotten 2 job offers from New York. And I didn't apply to these jobs. I haven't been looking for that type of work. Well, why people are now reaching out to me is because of my LinkedIn profile and really positioning myself out there as a person who can be able to get the job done. So sometimes we may have to step out of our traditional thoughts about how to approach the job force right now and do things a little differently to get our foot in the door. But working with a recruiter may be helpful to you. Speaking with people can be helpful to you. I'm going to stress that. I will tell you, in my own career, there's only maybe 1 or 2 jobs I got applying through some type of like job application. Everything else, it has been me speaking to people, me connecting with people, me people always remembering me, going to conferences. Like, I used to hit the streets of New York in the most professional way and go to different types of conferences, and then started to speak at conferences, started to volunteer at conferences, connected with people. One of the jobs that was recommended to me came from a lady who spoke at an event that I hosted many years ago. And she just always happened to remember me and was like, when jobs come her way, that she will share with people in her network. And I'm just a part of the network. So it takes a little tenacity, especially now post pandemic. They're trying to figure out how to get the healthcare workforce back to a space of a new normal. And so it's tough because you're like, okay, I need a job, I have bills to pay. But I will also tell you, look at some non traditional ways to get into the healthcare space. So companies like Amazon, Nike, they do have health divisions that you can potentially work in. It's not a health hospital, it's not a clinic, but you're still utilizing your management and administration expertise, and that may be the route for you. So try to exhaust all options, be very specific about job titles that you're going for. If you just put health administration, I'm telling you, you're limiting yourself. Under the health administration umbrella, there are so many different job titles under health administration. Look at health administration as the umbrella term. You have finance, you have strategic management, you have performance improvement, quality improvement, emergency preparedness and disaster. You have, I mean, the list goes on and on about how many different areas fall under the healthcare administration umbrella. So you really, really have to maybe you need to work with someone who specializes in that, having a coach to help guide you. So you may have to invest a little to be able to get to where you want to be, and take courses. So I do have a course, and that course I really break down different titles. It's titled from healthcare graduate to hired. Let me put it up here. And in that course, I go over this information in great detail, and that may be helpful to you. And so you can check out the link in the description box. And it's a very affordable course, but it's really, really detailed. So I hope that is helpful. All right. La Brea. Okay, so I'm going to go to some of the questions that I have, and then I'll come back to the comments. All right. I see more people are coming in, so this is exciting. Welcome. Hello to you all. Thank you for joining tonight's live Q&A. If you have questions, just drop it in the comment section, whether you're tuning in from LinkedIn or on YouTube. I will see it in my queue here and pull it up when I get a chance. Okay. So let me take this down. Let me go to the questions that I have here. All right. So the next question that I received, I am a patient care tech manager and medical records clerk at a drug and alcohol and eating disorder rehabilitation facility. I want to gain a degree in healthcare administration because I feel this education would improve my managerial skills and give me education on paper to contribute to my career. If I already have a career such as this, would you think a healthcare administration would provide opportunities to grow? The answer is absolutely. I do believe more education will help you grow. The healthcare industry is ever evolving, and so is the management side of the healthcare industry. Things that we used to do 10 years ago looks completely different today. So absolutely. Now, can you afford it? There's some other things to take in consideration: cost, time, availability to kind of go through a program, and is there alternative options? Maybe if you can't afford to do a degree, a certification may help you. So yes, at more education, that's one of the things that they highly encourage us to do, to always remain abreast on what's happening in our field. But is it the degree something that you can afford at the time? Do you have the time to dedicate to a degree? If not, maybe checking out something alternative, doing a certification, which is usually a little shorter in time frame, or looking at places like Coursera. They do offer courses as well, so that can help you. But to answer this question, yes, you acquiring a healthcare administration degree with the role that you have can really take you further and help you be promoted up in your career. Okay, so another question I got. Okay, this is a lot, so let me pull it up. It says, I wanted to say thank you for all the information you have provided. I truly appreciate it. I also wanted to know if you could give advice on how an LVN, so a licensed vocational nurse, bedside nurse, such as myself, can transition into healthcare management or administration or information. Okay, so 3 different buckets. I want to move away from the bedside, but don't know which position would help me enter the business such of healthcare. Would you recommend case management? Thanks again. So this is a quite loaded question. And once again, it goes back to your preferences and your interests. What are you interested in? Management looks totally different than information, and it looks different than administration. So, slightly, management looks slightly different than administration. But what are you most interested in? Not necessarily what can get your foot in the door, because you can get a job and it's something that you will hate. Case management is a good background, especially if you have that nursing degree or nursing information. That's the better way to say it. It can help you. I used to be a program management manager for a case management program in a nursing home. And in my work with them, working with the social workers to make sure that they give appropriate care to our clients. So it may be a good background to you, but it all starts with from your interest and what you see yourself doing. Okay, because not every role may be the best role to transition into the field. Okay. Okay. So I think I answered that question. Okay, this is another big question. So I'm going to pause on that. I'm going to come back to the comments because I see a few more comments coming in. So bear with me. Okay. This one comes from Felicia. May I ask, should we worry regarding student loans after obtaining a degree? What is the best way to apply to this? Okay, I think I'm trying to understand the question. Are you asking, should you be concerned, Felicia, about student loans after obtaining a degree? What is the best way to apply? So, from my understanding, let me answer it from what I think you're trying to ask. If you can avoid getting a student loan to support your education, by all means do so, because they only give you about 6 months. I know that the pandemic allowed for some kind of types of extensions, but I think they're about to end that. So I think they're going to go back to normal payments. So if you can get an education without getting a loan, that is the best option. Okay, not everybody has the money up front, and so they need to have a loan. But when you're getting these loans, and this is some physical management practices to apply, make sure you're very clear on what you're signing up for. Okay, don't just sign and think it's done, because it will meet you again. And depending on what type of degree you're getting, there higher you go up in your education, the higher the cost of that education. So the master's degree program is expensive. A doctoral degree program is expensive. All right. So you really have to kind of sit down and look at your finances. And maybe I'll do a video on how to manage finances as an academic, student, and etc. Give me an idea. But I think that if you need to do it, the option is there. But if you can try to get a scholarship, grants, have your organization, if you're working for a job, do tuition reimbursement, these are all better ways than getting a loan. So I hope that helps. Felicia. Okay. Felicia says, also, is it beneficial to obtain more than one master's or doctorate degree? Not necessarily. Just really depends on, once again, your interest, why you want multiple degrees. I'm a person who has gotten all 3 degrees, and I'm not really trying to do a whole nother doctoral program again. I'm not trying to do a master's program again. It's just not for me. I've gotten the education. It has sufficed, but some people are different. I do know people who have a doctorate degree and then they go back and get an MBA. I know individuals who go into a whole nother field. At one point, I was considering getting a MPH just in addition to my doctorate degree, but then I thought about it and I said, no, I'm not interested. So do you have to have more than one type of degree? Not necessarily to get into this field, no, but it's really, if can you afford it? Is that something you want to do? Maybe you are a person who you are coming from a completely different industry. So maybe you have a degree in humanities, but now you want to get into healthcare. Then that makes sense why you would get a master's degree or even a doctorate in the healthcare space. But if you have a degree like business administration, management, it's not a need to have multiple. Can it be beneficial? Probably. But let me just put it this way. A lot of getting your foot in your door and operating in these spaces is not just with the degree. The degree, yes, gets you into the door, but it's really dependent on you to sell yourself and sell yourself in the most professional way. Networking helps with that. I started working as a professor before I got my doctorate degree. How I got my professor job was knowing someone who thought about me, not necessarily that I asked. I never had academia on my career list. I always thought like I'm going to work, get into the hospital, get into executive management in the hospital and be going. But the friend through my trainings, I used to do trainings at different jobs that I worked at, and then being a part of another organization with the UN group, she was just like, "Hey, I think you may be great for bringing this expertise into the classroom. Do this, this, and this." And that's how I became a professor. So you really have to position yourself out there for people to see your value. You can get to a place in your career where you no longer look for opportunities. Opportunity starts to come to you, but you have to put in the work. You have to go through the grit to get to that point. It just doesn't happen overnight. Okay. So I hope that's helpful, Felicia. Okay. I see some more questions. So let me pull that up. Okay. 𝐋𝐚𝐭𝐞𝐬𝐭, I hope I said that right. Says, "Hi, doctor. Sorry for being late. I'm from Ethiopia. I want to get a remote job on public health." Wow. So it's just amazing to see how many times I could be in different countries from the comfort of where I'm at. But welcome, Kanisha. Thank you for tuning in from Ethiopia. You may want to look at organizations under like the UN or private sector organizations that may offer you different types of public health jobs and may offer a remote option. Yeah, that, or looking within Ethiopia. I've never been to that part of Africa, but see what they have there, and if they're offering remote, then you can pursue it. But if I was on the continent, I would definitely look at organizations like the UN, looking at the World Bank, those type of organizations to be able to get a remote role. Okay. So I see a question comes back from Manny. He says, "Does it really matter if an MHA program is CAM accredited?" Yes. Accreditation is very important. I don't care what anybody else tells you. The accreditation doesn't matter. They're giving you the program for free. Absolutely not. Accreditation matters because that accreditation validifies your degree. It lets any person that who you get hired for, or even if you want to enroll to another university, know that the curriculum that you were taught aligns with here in the US, the Department of Education standards. And so there are universities that are operating and do offer programs that are unaccredited, but I don't recommend, from a person who works inside of academia, I don't recommend that you attend a university. I don't recommend that you spend your money on a university who has not gotten accredited. Now, if they're in the process of getting accredited, that's a different story. But I will even tell you, wait to see they get the accreditation first. Because the worst thing that can happen to you is to commit all your time, commit all your energy, work really hard, and then they tell you that, hey, your degree is not valid. You don't want to go through that. It's the same thing. Just think of it this way. You have your internal medicine doctors, which all medical doctors, they learn in primary care in their, process of getting their degree. But if you wanted to go to get cardiovascular care, you're going to go to someone who specializes and who has gone through the licensure and accreditation to specialize in that area of the body. The same thing with your degree. You don't want to get a degree from an unaccredited school or an unaccredited program, because you can have the university be accredited and the program is not being accredited. This is why accreditation is there. And I encourage you to go up onto these accreditation websites and just see how they accredit universities. Just read about the accreditation and they'll tell you what it's all about. So no, I do not. Yes, to your question, Manny, yes, accreditation does matter. Okay. So I'm going to go back to some of the questions that I received, and then I'll come back to the comments. I see more people are coming in. So thank you so much for tuning in. I'm so excited to have you here. If you have questions, just drop them in, no matter if you're looking in from LinkedIn or YouTube, drop your questions and I will pull it up to answer it. Okay. All right, so this is the loaded one. Says my company could pay for 95% of my MHA program as long as I do it in a university that they partner with. The university offers both a campus in campus and online, but the in-person program is accredited. However, the online is more suitable for me because I'm a single mom of a 2-year-old and need a flexible schedule. I don't want to get in depth to get a degree, and the fact that my company is paying for the most of it is the biggest motivator for me to go for it. But I couldn't commit to having a strict school in-person schedule because I do want to put my son to bed every night. I heard you say in another video that accreditation is very important. What would you recommend I do? So yes, try to find another university if you really want to do it online that's accredited, or you may have to make that sacrifice and try to figure it out. I can't tell you how I understand. Let me say it like this. I understand you wanted to, raise your child. I'm all for family first. And so, but with this scenario, I would tell you don't, just because they're paying for it doesn't mean that you should do an unaccredited program. It is not going to be helpful to you down the long run at all. And even if think about you trying to go to another university, they look at your transcripts. And if they see that your transcript comes from a university that has not accreditation, have not been accredited, they're most likely not going to accept you into their program because they're going to figure what you've learned is not of quality. That's how they see it. All right. So I think I just answered that previously, but go to universities that are accredited. There are so many universities out there, and I know cost is a factor, but I'd rather you go to pay the money and go to a school that will give you a degree that will remain viable and reliable compared to getting it for free and it's worth nothing. Okay, so the next question I received. My name is Javon. I'm currently a senior pursuing my bachelor's in finance with a minor in business administration and management. After graduating, I want to attain my master's in healthcare administration. So I truly appreciate this video. It helped me solidify my decision of furthering my career in the healthcare field. This is awesome. This is one of the reasons why I started the For Health Scholars. So I'm so happy that and grateful for all and everybody who find value from the content that I have been sharing and the content that's to come. All right. So the next question I have is the digital membership separate from the course? I want to do the mentorship, but wasn't sure if I was the same of the course. Okay. So at one point in time, earlier this year, I had did a 4-week a mentorship program intensive. I'm going to probably do that again in October. And if you purchase the course, you do get access to the previous recordings from that first round of the For Health Scholars Trailblazers mentorship program, which is awesome. A few of the individuals that I mentioned on the congratulatory list earlier in the video, they come from the mentorship program. So it's to see their success of taking what was taught in that 4-week intensive and really getting a job is helpful, and it makes my heart smile. So I'll let you all know when I open the second cohort for the Trailblazers program. Right now, I'm making sure that we have the website and everything up so that it makes it more easier for people to sign up and to participate. Okay. The next question I have, I want to go into healthcare management, but I'm afraid that my BS in biology degree would be all for nothing. Am I wrong about that? So biology falls under the health sciences. It is a little different than the management side of the healthcare administration field, but it's not all for nothing. I feel like every experience that you go through will later down the line show you it was worth it. So for a person under biology, you probably can get some of the credits that you had in your BS degree to be transferable depending on the university. But you are going to be learning something different from the health sciences. So biology is a different part of the health sciences than management. Management, you're learning about health systems, leading people, leading organizations, solving problems in healthcare, managing finances, strategic decision making and planning, looking at human resource management, IT technology. So it may be a little different than what you experience, but I don't think it's all for nothing. It just may enhance your experience as you get a master's or a bachelor's in health management. Okay. So the next question I have, this video is incredibly helpful. I'm in the process of making a career change and healthcare is at the top of my list. I have been looking at all of these degree options and now I have a better understanding and focus of each. Thank you. You're most welcome. You're most welcome for the person who dropped this comment. All right. So those are all the questions that I have. I'm going to go back now into the comment section. If you are just tuning in, because I see more people are coming in, welcome. Drop your questions in the comment section. I am definitely answering questions live. So I see another question here. It comes from Felicia again. She says, these master classes are amazing, Dr. Owie. I would like to attend a session in person with the pleasure of meeting you one day. Hopefully, I'll be able to do an in-person event now that the world is opening up. So hopefully one day I'll come to a city. I'll probably start in my home city of New York first because I do have some contacts there that can help me make that happen. So maybe in the future, probably end of this year or early next year, I may do like a live event, whether it's like a live recording or an actual full-fledged event. I'll still think about that. But if you have suggestions, maybe I'll put that on the poll. If I was to do a live event, which city you would like me to come to, and what would you like to see? That will kind of get me some momentum and allow me to partner with individuals to make it happen. But thank you, Felicia, for your kind words. All right, let me go back to the comments. All right. Kinesia says, I really thanks, but I'm struggling to get even for an internship. As you said before, who you know is the most important thing. And anyone who may know working in Africa, please let me know. Yes. So definitely who you know. We're in that season. Africa, there are many NGOs, there are many private sector organizations, there are even public sector organizations that you can work for that can offer public health. Public health is more recognized than healthcare administration. And because healthcare administration is really, if you do it here in the US, you're learning about the US healthcare system. But public health is more of a global degree. And so you really have to just do some research on your end. Like I said, you can start with the United Nations. They are very prominent institution that offers public health type related programs. So the United Nations has different types of organizations under their umbrella. So they have UNICEF, they have UNFPA, from what I recall. They have different types of organization under the UN umbrella. So that's a great start. Look at what can I even tell you? In your case, Kinesia, Peace Corps, maybe instrumental to you. Peace Corps have places all around the world. Now, Corps is going to give you more of the internship opportunity, but I don't think they pay for Peace Corps. So you have to kind of do some research. I'm not familiar about Ethiopia, so I'm not sure, but in the near future, if I think of anything, I can record a video on that. I am thinking about recording a video about healthcare management and non-clinical degree programs in universities across the continent. So that should be coming in the pipeline soon. All right. So, all right. I have some more questions coming in. All right. So, this one is from Gregory Hines. Hello, all. I'm preparing for an interview on Friday for a senior leadership position as a lead for professional development. Any advice or tips? I have a 10-minute presentation as well. So, Gregory, I think you're based in Europe. I think I remember you. Let me know if correct. But I think you came to another live chat session. So this is awesome. First of all, kudos to you for even getting that far. Senior leadership is a big, opportunity to as a lead for professional development. Any tips? So I really would tell you from my own experience is that showing them how well you can lead people and how you can problem solve, because we know that people come from all walks of life and they come with their own perspectives on the respective organization, which you're trying to lead them, and then you're trying to cultivate their skill sets. So you really want to show how you are a person who can get people to conform to an organization to receive professional development. Because even working in the hospital, I used to be the co-chair for a nurse mentorship program that was run at the hospital that I used to work for, and trying to get the nurses to come to our events was a challenge. And this was for their professional development. So really showing them how you are a people person, how you can in your own way lead people to cultivate their own skill sets, the ways that you will do it, making sure that it is evidence-based. I will tell you that it's evidence-based, but also yields great results. And so you may want to read previous academic articles that will help you on just tips and advice on how to, cultivate a professional development. You have a 10-minute presentation. So I would create a presentation that shows actual professional development initiative that you would do and how it would yield success in improving revenue for the organization, because organizations want to know that how do you cultivate human capital and helping them make money. All right. So look at how that will improve their performance and productivity and keep the retention of these people at that organization. Those are all of the things that I would tell you to talk about in that interview, in addition to being yourself. So have the confidence that if you've gotten that far, you're more than well qualified, and you just need to articulate that well and convince your interviewers that you are the best fit for the role. Well, all the best. Okay. Gregory says yes. Okay. All right. Thank you for again from joining. I think, what is it? Scottberg or something. I know it was not, it was a European country that you came from, but thank you for joining. All the best. That's great news that you have that interview. Okay. Manny says, this information is very helpful. Okay, Manny, I'm great. So I have about 10 minutes. I like to keep the lives just about an hour, but I have about 10 minutes. So I'm going to do final calls for questions. But once again, thank you all for tuning in and joining me for this month's live Q&A. I hope that it's helpful. I hope that it allows me to answer your questions live. Sometimes when I'm going through the comments, it's really hard to see all the comments and can kind of give you that detailed advice. And so this is why I do the lives. Okay, Gregory says, thank you. You're welcome, Southampton, UK. Okay, yes. I was like, I know I've seen your face before, but thank you for tuning in. All right. Kanisha says, as an African, I'm really proud of you. What you're trying to do for health professionals, it definitely changes one's life and his career. Okay. Thank you so much for your kind words. I really appreciate that. And I'm so humbled by all of the kind words that I received. I really appreciate that, and being well received from African countries I have never entered before, but my impact and my presence is there. So thank you for that. All right. I'm going through the queue box. I don't see anything else. Yeah, I don't see any other questions. So once again, I had talked about this earlier on for those of you who may have joined the live after that I discussed. So next week, Saturday, I'll be hosting a live masterclass. Let me pull it up here. Okay, here we go. All right, so I'll be hosting a live masterclass that talks about how to create a LinkedIn profile that attracts recruiters, because I really understand the challenges that many people are going through. So I'm going to try my hardest to give you as much as I know to help you get those jobs of your choice, right? To close that workforce skills gap. If you appreciated tonight's live chat, definitely show your support. You can purchase a super thanks. We would greatly appreciate it here at the For Health Scholars headquarters. But like I said, the masterclass will be live next Saturday. I'm going on live, so it's not pre-recorded. So if you have questions or you got some stuff that you want to ask about your LinkedIn, come over to the live. We're going to be on YouTube at 1 p.m. Eastern Standard Time. Bring your questions, bring your comments. But if I don't see any questions in the queue, so I'll probably end the live here. But once again, thank you for joining me tonight. I really appreciate it, and I hope this has been helpful to you. Make sure to like, make sure you subscribe, and make sure you share. And until the next time, bye for now.